All right, folks. It's Sumit Daya here, and today I'm gonna lay it all for you. Yeah, I know healthcare can be confusing. I'm here to clear it up for you. Hey, if you're working in a healthcare company and still scratching your head about all this, don't worry. I am there. My name is Sumit Daya, and stick to this information that I'll be carrying out. How Americans pay for healthcare. All right, let's cut to the chase. How do folks in US pay for healthcare? It's not as simple as walking into doc's office, flashing a smile. No, sir, here is good of all USA. There is a layer to this system, like legal system, but more paper. First off, most people get their coverage through employer sponsored insurance. Yeah, your job pays part of your premium, you pay the rest. And voila, you are somewhat covered. But if you are freelancing and don't have that cushy office gig, you are buying your own plan. Let's just say it ain't cheap. And for the folks who are older, maybe dealing with certain condition, Medicare is there to lend a hand. But if you are scraping by and need a little extra help, Medicaid is your safety net, assuming your state want to play ball. Let me put it to you straight, folks. Health insurance in America is like a lawyer in sticky situation. You don't want to need it, but when you do, you really need it. Without insurance, a trip to the hospital could cost more than my hourly rate. Trust me, that's saying something. Here's how it works. You pay the insurance company a monthly fee, they cover most of your medical bills, and in return, you get some peace of mind. But remember, insurance companies are like that shady guy you met in the back alley bar. Sure, they will protect you, but there is still looking out for the bottom line. That's where the fine print comes. Always read the fine print, people. Now let's get to the juicy part. How do Medicare, Medicaid, and private insurance differ? It's like comparing apple oranges and that mystery fruit you found at the back of your fridge. Medicare is for the silver haired crowd, folks over 65. It's Uncle Sam way of saying, hey, you made it this far. Here is little something to take care of those aging knees. Medicaid, that's a way of giving a little love to those who need it most. But heads up, it's funded by both Fed and state. So depending on where you live, you could either be golden or left hanging. Commercial insurance. That's for everyone else. If you're working stiff, this is probably what you're dealing with. Your boss may cover some of it, but trust me, you are still paying through the nose. Right, people, I'm about to drop some knowledge on the five type of insurance plans you might encounter. Think of choosing your favorite character from any movie. All got quirk, but some are unpredictable than others. Fee for service, pay for every single service you get, like paying me the hourly rate for every minute I'm saving your skin in hospital or in a healthcare organization. It's old school and it's pricey. PPOs, preferred provider organization, you get some freedom to pick your docs, but if you stick to the network, you save a few bucks. It's like ordering off the menu instead of la carte. HMOs, health maintenance organization, these are some more restrictive. You gotta see your main doc first before seeing a specialist. It's like needing a judge approval before making your next move. POS plan, point of service, a little mixed of both worlds. You have got a primary doc but can see others if you pay a bit extra, kind of like bribing your way to a better seat in hospital. High deductible health plans, HDHPs, with HSA, low monthly payment but high upfront cost. Think of it like taking a risky case. If you win, save a big, but if not, you are paying out of your pocket. All right, let's talk reform. You have heard about Affordable Care Act, right? Yeah, Obamacare, love it or hate it. It did cut down the number of uninsured people, but it's not one size fit all solution. The ACA expanded Medicare and introduced insurance marketplaces, but that was just a start. Some say the next step is single payer system where the government covers it all. No middleman, no insurance headache. Others, they want to keep tweaking the current system. Here is the thing, change is coming, but whether it's good or bad depends on who's calling the shots. All right, people, that's low down on how healthcare works in US. If you're still confused, let's face it. Who isn't reach out to me? My name is Sumit Dhaya. I'm the man who will guide you through this maze. If you got any question, leave them in the comments. Smash that like button and subscribe. And remember, if the system got you